respiratory conditions like asthma and COPD. There are 40 million people in the US alone with asthma and COPD. More importantly, more than 60% of them have uncontrolled condition that leads to millions of ER visits and hospitalizations every year. Why is the current standard of care so ineffective? Because it requires a patient to subjectively assess their symptoms on a daily basis and choose their medication accordingly. This process is often error-prone. This, combined with the clinicians not being able to intervene early, results in millions of adverse events every year. Curie is focused on addressing these fundamental limitations. We have a three-part solution for this problem. The first part, we've built a unique AI technology that understands what symptoms someone is experiencing and provides an assessment of respiratory health through passive continuous monitoring of audio. Without asking the patient to do anything at all on a daily basis, we can understand what symptoms they're developing, how is their disease state progressing. We can also predict when adverse events are going to happen from audio alone. The way we do this is by placing a device at the bedside, as shown in the picture. Our AI can run on any device that has a microphone on it. The second part of the solution is a web app that provides insights to clinicians about which patient to focus on and when to intervene. And the third part is a mobile app for the patients to obtain guidance on how to better manage their condition. In some of our pilots, we have already shown that the Curie solution provides strong outcomes. Right? So in our very first pilot, we have proven that we could reduce the adverse events by greater than 90%. We were able to improve the quality of life, which translated to significant improvement in how many nights they had symptoms, et cetera. So Curie Solution works and has a substantial, adds a substantial value to the current standard of care. We're targeting, out of the 40 million people with asthma and COPD, we are focused on those people that get their coverage through Medicare Advantage plan. Medicare Advantage is the fastest growing value-based care model currently in the US. Through this segment alone, our serviceable obtainable market is $5 billion and is projected to double in the next 10 years. Our go-to-market strategy is to work with any provider and payer that serves the Medicare Advantage enrollees. We charge anywhere between $25 to $150 per participant per month. Traction. So we're particularly excited about the traction we're seeing already. We've closed an agreement with a primary care provider called Galileo Health, based in New York and North Carolina today. They are a value-based care provider. And like that, we are in conversations with a number of primary care providers that primarily serve in value-based care models. The CEO and co-founder of Galileo Health, Tom Lee, was also the CEO and co-founder of One Medical, the fastest growing primary care startup that is about to go public anytime this year. We are a really strong team of technical and business leaders. I have deep domain expertise in healthcare. My head of AI, Sridhar Nimala, comes with deep expertise in audio AI background. He has built products that generated more than $300 million in revenue in the past few years. We've just brought on board a head of strategy and business development who previously started and successfully exited a company in the healthcare and wellness space. Currently, we are raising $2 million in seed. $1 million has already been committed. Our goal is to add 4 to 5 new customers by the end of the year, with the goal of adding 2,000 participants on the platform. I'm really excited about the opportunity and looking forward to speaking with you all today. Thank you.